Hi, I'm Professor David Challis. I joined PSSRU a long while ago in November 1976, and I'm currently the director of the PSSRU branch at Manchester. Over the last 40 years, it's grown massively. There were 3, maybe 4 of us there when I started, and now it's many multiples of that. I think they're Blevin, actually. Blevin, his enthusiasm, his capacity to knock on people's doors even when they were snoozing, and then to walk in and to energise and activate all of us. He was unique and special. I moved from a psychiatric hospital as a staff member to PSSRU in '76, and I went there to run the case management study, the Kent Community Care Project. After that, there were 3 other offspring of the Kent study, the Darlington study, the Gateshead study, 2 of them, and the Lewisham study for people with dementia. So very much focused on that, and it's grown into a whole range of studies on long-term care of older people. The case management studies impacted on long-term care policy immediately in the UK with the NHS and Community Care Act, and it's gone on to do so in other countries. So, for example, the Lewisham study has been used as part of the French Alzheimer policy in the last 3-4 years. I think there are examples of social care being more receptive to research, but in very recent times with reductions in funding, it's been increasingly difficult to do it. So there's this paradox of increasing willingness and reduced capacity happening simultaneously.
And thinking of PSSRU as a whole, in what areas over 40 years has it made the biggest overall impact on practice?
Oh dear. I think some of the work on care homes, I think the case management work impacted on practice. I think some of the work we did on personal budgets and their weaknesses have all impacted on practice. Really no contest, is there? And it's self-interested. It would have to be improving long-term care of older people by improving the funding system that made it a viable approach. I mean more money, but not just in a simplistic taxation way, but planning the funding processes. It might be through an insurance approach, but certainly a planned, viable, long-term approach to funding. So it would have to be something probably about improving the quality of care and access to healthcare of people in care homes. I mentioned it already in terms of what I would want to do. I think the biggest issue facing social care in terms of what we do is long-term care of older people and funding that process. I think the other thing that faces long-term care at the risk of being really unpopular is saying that is local government anymore a viable home as a social care lead organisation, or should we be thinking about more movement down the Australian pathway that might improve quality? I have very, very low confidence indeed, for 2 reasons. One, I don't want to be told I've got a personal budget and I can get on with organising B&Q care. I would like to have somebody sensible to guide and advise me, and I wonder about the viability of that. Secondly, I wonder about the funding other than what I might purchase as a self-funder, maybe with my American Express insurance policy or equivalent.